Let's talk about how to have that first postpartum bowel movement after you have your baby. Hello, my name is Oriana. I'm a pelvic health physical therapist assistant and a mom of two. I'm actually 2 months postpartum myself, so I just went through this all over again, and I want to help you have a better bowel movement. That way it's less scary after you have your baby, okay? Now, there are a few things that people don't consider. They usually don't consider the bowel movement until it's time to have it. And whether or not you had a C-section or perineal tearing or even just vaginal without any sort of tearing or scarring, you're still going to be a little bit like, what's happening? So let's go over things that we want to consider beforehand. It is really helpful to prepare your body before you have your baby, what to do during, and then how to continue to keep that pelvic floor protected as you are healing in your postpartum period. Now, before you have the baby, you want to prepare your body for that bowel movement. And that's going to make sure that you're getting proper fiber intake, water intake, nutrition intake, and you're also doing proper toileting mechanics and working on your pelvic floor relaxation. So these are all things that we want to consider, and it's just is really helpful to already kind of be in that mindset anyways, towards the end of your pregnancy. When it comes to that fiber intake, there's different types of fiber, and you can look into which one. I just like to think of, let me just try to get in fiber from different food sources. There's a soluble and an insoluble. One will bulk up your stool, one will kind of like slow things down. One comes from like thick things that can't be broken down in your system. The other one gets absorbed by water, right? So you can look into what those different types are. My personal favorites are going to be lentils, beans, apples, bananas, dates, which you're already eating at the end of pregnancy probably, and also popcorn, oatmeal. Those are like my go-tos whenever it comes to that. Chia seeds. The one thing that you want to consider is that you don't want to go from 0 to 100 whenever it comes to increasing your fiber intake, because the body will not like that. And especially at the end of pregnancy, when you already don't have a lot of room there, you don't want to get constipated or have a lot of gas. So just consider doing a little bit by little bit, every few days, increase how much fiber you're intaking. That way, whenever it is time for you to have that first postpartum bowel movement and the few bowel movements afterwards, it is a lot easier just to like get it out, and you're not wiping a million times. Like your body's just able to excrete it. When it comes to water intake, a lot of people focus on just drinking water, and some people overdo it because they'll say, I'm going to drink all this water, I'm also going to drink these electrolytes, I'm also having all this coffee and this tea. And you should just be drinking like half of your body weight in ounces a day. That is so hard to do. I've tried to do that myself. I'm a really hydrated person, and I struggle at doing that. So what I like to think about is, how can I eat my water, right? So having, watermelon or some type of melon, or doing steamed veggies rather than roasted veggies, having lots of soups, having lots of broths, those are all going to increase that water intake, not drying out your food to eat it, but instead like hydrating your food in order to eat it. I even think about like how pasta can be pretty hydrating, especially if you get like a pasta with fiber in it. That's like a bam, like win-win situation, because the pasta is going to absorb that water, and then you're eating it, and then it also has the fiber to help you move that pasta through. So just think about eating your water. It makes it a lot easier, especially at the very end of pregnancy. Let's talk about that nutrition intake. So that nutrition intake, you want to make sure that you're getting things that are going to help your muscles move, because the bowels are smooth muscle, and they need certain like chemicals basically in your body. They need certain nutrients in order to contract better. So it's going to be potassium, sodium, magnesium, even calcium. All of these things help the muscles work better, and we love that. So a lot of people tend to have a higher sodium diet, and then a lot of people are adding in a lot of electrolytes lately, which also have high sodium content. And so just consider that if you do have a high sodium diet, maybe you're eating a lot of processed foods, maybe you just like can't stop munching on some tortilla chips, whatever the case may be, try to get some potassium in too, because that potassium works with that sodium. So just think about that. And magnesium, not only does it help the muscles relax, so it can help your body relax enough to be able to pass the bowel movement through, but it also helps to bring moisture into your colon. So you can look into different types of magnesium. Now, as a PTA, nutrition is not my specialty. I just know that we need the proper nutrition in order to get the muscles to work better. So you can look more into what that means whenever it comes to your food intake, but just know that proper nutrition does help get things going. So just prioritize that towards the very end of your pregnancy as well. Now let's think about pelvic floor relaxation, because unfortunately at the end of pregnancy, the way that our body shifts, how our pelvis rotates anteriorly, it literally shortens the pelvic floor tissue, making it tighter, making bowel movements even harder than they may already be. And you also have that progesterone that is allowing, everything to slow things down. So we want to think about pelvic floor relaxation. That's why it is really helpful to use a squatty potty or a stool. And whenever you are doing that, and I'm going to show that here at the very end of the video, but whenever you are doing that, your feet are flat on the stool or the squatty potty. You can have your knees go towards each other. They don't have to touch, but go towards each other. And you lean forward a little bit, which I know is hard at the end of pregnancy with a big belly. But you do that. You exhale whenever you're having the bowel movement, like you're trying to blow through a straw. Nice, long, relaxing exhale. And then just let it happen. Don't sit on the toilet longer than 5 to 10 minutes at a time. Usually 10 minutes is like my rule. And then after you have the bowel movement, go ahead and go upside down in a little inversion, so that way we can allow that blood flow that came in, because a lot of, like, the toilet kind of suctions the blood flow down, and this can increase things like hemorrhoids, and we don't want that. So after you sit down on the toilet for about 10 minutes, then go ahead and do a little puppy pose, inversion pose, and maybe I'll show a picture of that right here. So that way we can be on the toilet, try and like get the pelvic floor muscles to relax, but then also make sure we're helping avoid hemorrhoids, so that way we don't get scared to have that first bowel movement. There's also the mobility that you can do to relax your pelvic floor muscles at the very end of pregnancy, and I have a video of that up, of things that you can do to kind of get the baby to come through. That will help you have more relaxed pelvic floor tissue, so that way you can allow that bowel movement to happen. A few other little tricks that you can try is eating at the same time every day, having warm foods before you want to have that bowel movement, and trying to sit on the toilet for like 30 minutes after you have a nice warm meal, trying to have it consistently at the same time every day. Those seem to help to get the bowels to go regularly. So getting that nice bowel movement before the baby is going to be helpful. Now, at the very, very end of pregnancy, if you go into spontaneous labor yourself, you may have looser bowels, and that's okay, because the body is releasing prostaglandins, which are these hormones that just allow everything to come through. So you may feel that you're just kind of able to like get things out a lot better, which is great. And hopefully, if you're taking care of everything that I've listed so far, it's just easy and effortless, and that has basically helped to clear you out, ready to go for when baby comes. Now, what do you do after you have the baby? So no matter what type of birth you ended up having, immediately whenever it is time for you to go to the bathroom, you're going to be thinking about your pelvic floor. There's no doubt about it. And then whenever you feel the urge to have the bowel movement, you're definitely going to be thinking about your pelvic floor. So what do you do after you have the baby? Well, first you want to focus on reconnecting with our pelvic floor. You want to focus on that water intake once they take the IV out. You can focus on like light, gentle motion through your rib cage and with your hips. And then you continue to focus on, fiber. You can ask for stool softener, things like that. For me personally, as soon as I had both of my babies and I was with my postpartum nurses, I asked them for a stool softener. Immediately, I started to do diaphragmatic breathing, where I would take a deep breath in. Whenever I would exhale, I would do a nice long exhale out through my mouth like I'm blowing out of a straw, and I would do a Kegel. That way I could reconnect with that pelvic floor tissue, because that's going to be important to understand like what's happening at your pelvic floor while you're trying to have the bowel movement. And I always say that, you're feeding the baby basically every 2 to 3 hours. So every 2 to 3 hours, take 3 of those deep breaths with a little Kegel at the end of that exhale. That way you can just kind of reconnect with your pelvic floor every little bit, right? I immediately asked for prune juice and would just kind of sip on some prune juice throughout the day. I made sure that every single meal that I had some sort of fiber in it, whether it was like avocado, beans. There was a breakfast that we would have, and it didn't have any fiber. My husband wanted to go get food, and so I asked him to go to the store to get raspberries. Those raspberries have a ton of fiber to them. So he went and got that, and I would just munch on that throughout the day. And then I used my squatty potty, and I'm gonna go over how to use a squatty potty without overly stretching that perineal tissue that just got stitched back up. Okay, so I was so stoked that I brought the squatty potty for my second birth, because I didn't have it for my first birth. I'm not sponsored at all. I just genuinely think the squatty potty is fantastic at getting your knees above your hips, helping you to have better bowel movements. Something that we recommend to all of our patients, and there's a reason why it's so popular if you look on Amazon reviews. So they have the portable one. This is the actual squatty potty brand. It, in my opinion, is a little bit hard to set up, but it's really flat. So I just packed it. Now, with my first postpartum, I did not have this, so I asked them for a stool, and they couldn't find me a stool, which was like, I know you guys have stools in the labor delivery unit, so like why there's not one stool in the postpartum unit, but it's fine. I made it work. You can also always just put like a little toilet paper under each foot. So there's that. So you go ahead and pull this up. My husband actually broke the one that we used in the hospital, which is crazy, whenever he was taking it down. But that's what it looks like, you know, set up. And then you're gonna set it up right in front of the toilet, like this. Put your feet on, have your knees go together after you have the baby, and go forward. So you can't see it there, but I'll show you this way. Here you go, knees together, go forward, okay? Now, what if you feel like that tissue is stretching way too much? What I found to be really helpful is to put 1 foot up at a time. That was extremely helpful, and I would just kind of take a few deep breaths, exhaling out through my mouth while I would sit there. Now, what happens if you feel like the tissue is just stretching way too much? Then you can go ahead and wrap toilet paper around your fingers, and then you could put that at the base of your perineum, so that way you can hold it there while you try to have your bowel movement. And you're exhaling, nice long exhales, relaxing inhales, nice long exhales. Whenever you are doing the exhales on the toilet, you are not doing a Kegel. You are just trying to relax and allow everything to happen. And if nothing happens immediately after birth for those first like 5 minutes, it's time to get up, because we don't want to overstretch that tissue that just got stitched up. Now, what happens if you had a C-section? They should give you a pillow, but you'll take a pillow and you'll hold it against your belly and exhale as you try to go, still using the squatty potty. If you don't have perineal stitching, if it was a planned C-section and you didn't have to like labor down, then you can do both on the squatty potty, and that might feel okay. But you would use a pillow as you try to go. Now, in the hospital, your uterus is definitely not shrunk down yet, so you can go ahead and massage above your uterus. So if your uterus is going to be, you know, around here, you can massage the tissue above that. You can put a little bit of pressure on the tissue above that, especially since you no longer have pressure against your bowels. Sometimes we need to create a little bit of that pressure for the muscles to get stimulated to do their thing. So that's okay. My OB personally gave me the okay to massage my belly, but using light pressure over the uterus while it is healing up. So I just kind of avoided that. I just avoided putting pressure anywhere where my uterus still was. That way, as it shrunk down, then I would start to reach more of my bowels, but I would just go above the bowels. That way I wasn't messing with any of the healing that was happening there. And then I talked about light rib cage, light hip mobility whenever you are freshly postpartum. So that could be sitting up in your bed and just rotating your rib cage like this. If you had a C-section, it could just be rotating a little bit like that, right? Even if you had a C-section, it's still okay to apply a little bit of pressure on your abdomen. You're just not like digging in there like crazy, so just keep that in mind. But a little bit of pressure is okay. It actually may be beneficial for some of that lymphatic drainage that we want after you have an abdominal surgery. But yeah, you can go ahead and rotate your rib cage a little bit. You can sit up on your bed with your legs together, and you could just like rock your legs side to side like that. I wouldn't do it with legs apart, you know, freshly postpartum. And then you can also, what felt really good for me was laying on my back, just having my knees in, and then just rocking a little bit side to side with my legs together like that. It's the first thing that I did. I also felt comfortable going one leg at a time, but if you don't feel comfortable with doing that, you don't have to. And again, if you have a C-section scar, you may not want to do that. So you could have your legs just bent like this and just rock a little bit side to side like that, or just put that compression on the upper parts of your belly to help get things moving. Now, what do you do whenever you get home? Well, first things first, you want to make sure that you have a stool softener at home, either one that was prescribed to you, or you can ask your doctor what type that you can have at the house. But having a stool softener will be really helpful for those first, you know, at least that first week or so. And then you also want to make sure that you continue that water intake. Having lots of soups, it tastes yummy whenever you're trying to breastfeed and you're really exhausted and healing. The soups are fantastic. So having lots of just water intake in some form. Make sure again that you're getting that fiber in. I personally prioritize fiber and protein with every single meal at my postpartum, just to make sure that things were moving and also that my tissue was just getting the nutrients it needed to heal up. So that's personally what I did. But making sure you get the water intake, that fiber intake, and that you can continue the little bit of movement right through your rib cage. You can continue to exhale whenever you are trying to have the bowel movement. You can also continue to do those Kegels at the end of your exhales for the first few days. If you start to feel like things are like getting really, really tight at the back of your pelvic floor, or anywhere in your pelvic floor, then maybe stop the Kegels, but continue to do the diaphragmatic breathing. All of that is going to be really, really beneficial. If you had a lot of trauma at your perineum, then you can use sitz baths. So you can get like a sitz bath attachment to go onto your toilet. You could use Epsom salt and just sit down in that for a few minutes, or you can do like a little 2-inch bath in your actual bathtub and do some Epsom salt with that, have a nice little sitz bath that way. And then you can also use really nice products. So using like, I personally love the perineal foam that comes with the Freedom Mom postpartum kit. I'm not sponsored by Freedom Mom, but I just love their stuff. And I like using the Tux pads. Those feel really, really good. Trying to decrease how much you're using the ice packs, depending on how you're feeling. Like once you're feeling good, maybe not using the ice packs. Keeping up on top of your pain medication. So if you're in a lot of pain after having the baby, make sure you're taking your Tylenol and ibuprofen, whatever it is that your doctor recommended for you, continue with that. So that way you can allow that tissue to heal up and continue to just use a squatty potty and just try to have those better bowel movements after you have the baby. So yeah, I hope that that was helpful. All of us who plan on having a baby are gonna have to go through this, and it's something that I feel like everybody neglects to think about until after it happens. Everybody thinks about pooping on the table, but they don't think about what it's going to be like to actually try to go poop. So I hope that that was helpful. Go ahead and save this, like it, comment, share it, send it to a friend that you know is pregnant, because it's something that maybe nobody wants to talk about, but everybody will have to deal with it. So let's just help people deal with it a little bit better. Okay? All right, I'll see you in the next video. Bye.